Good afternoon, everyone. ITECH welcomes all the participants for today's National Distance Learning Seminar Series. Today's topic is ART Preparedness and Adherence Counseling for Prevention of LFUs, and speaker is Ms. Mona Balani. Ms. Mona is a postgraduate in sociology and is currently working as Program Officer, Care and Support for India HIV/AIDS Alliance. She has experience of more than 12 years in the program management at field level and is social development field, basically public health issues such as HIV/AIDS. She had worked with community-based organizations at various levels to build their capacities in advocacy, counseling, and outreach for people living with HIV and TB/HIV co-infected communities in India. She had also formed CBOs as a founder in the state of Rajasthan, where she worked in close coordination with SACS and NACO in capacity of state project officer in different interventions, and had represented as person living with HIV and former patient of tuberculosis in various state, national, and international level committees. She had provided technical support in community system strengthening to train 220 community-based organizations of people living with HIV in India. She had also been involved in various research programs and had attended various international conferences. We welcome you, ma'am, for today's NDLS session. I would request
Good afternoon, all. So hope you all are doing well. Okay, so as Divya mentioned, like today's session is on ART preparedness and adherence counseling for prevention of LFU. So welcome you all. So as you all know, like just recent our government of India announced the policy of test and treat. And so that this presentation is so essential for us as a community or as a service provider, both of sides. So as Divya also mentioned, like my experience is working with the community-based organization is like around 10 to 12 years. And I especially work with the people living with HIV in different states, different regions, different geographical area, different circumstances from different key populations. So I tried to collate my experience in this presentation. So today's presentation has the outline of the treatment preparedness. It includes the LFU cases prevention, how we can track the LFU cases, and I will also share some good practices from the field. So as you know, like I am working in Vihaan Care and Support Program since 4 years. So our Vihaan Care and Support Program is aligned with the National Treatment Program, and it has goal to improving the quality life of survival of PLHIV, quality life and survival of PLHIV. It's aligned with the ART goal also. And we have some major services under our Care and Support Program. There is prime service is LFU tracking and missed cases tracking. Other one is treatment literacy and provide adherence support to the people living with HIV through outreach services, provide social psycho support to educate them to their family members and to motivate their family members to maintain the treatment adherence. Our third service is linkages and referral for the other services, other health and non-health services, partner testing, like people living with HIV, their partners and family members who doesn't have the HIV testing. So care and support staff also promote the HIV testing among the family members, spouses, partners of high risk group people or key communities people. And also we are tracking them to link with the ART center. And we are also having the TB screening provision under our program. So CSC staff is also providing the support to screen each PLHIV, although they are also screening at the ART center, but we are trying to filling the gap through this indicator. So PLHIV who doesn't have the TB screening since 6 months, so we are screening them as per the 4 symptom basis as per WHO guideline. And we are also providing the counseling services under the Care and Support Program. On thematic based counseling, we are providing treatment adherence counseling, treatment preparedness counseling, positive prevention, positive living counseling, and we are also ensuring their retention in the treatment. So as a comprehensive packages, we are providing a whole counseling package. So as we know, like for the treat all, how we can play our significant role to retain the PLHIV under the treatment program. So there are certain key players which are playing the essential and important role to retain the PLHIV under the program. So if we start with the ICTC, so first service delivery point is ICTC, where the person get to know their HIV status. So what is the role of ICTC counselor? So first they have to prepare the person who are getting his or her HIV status for the accepting in their result, like they make them understand to accept their HIV positive result, because that is very difficult to accept their result, like while they are found themselves HIV positive, then it is very difficult due to social stigma, due to their self perception, due to their lot of queries inside, then it is very difficult to make them understand, like they have to accept their HIV positive result. Sometimes it's also good to make them understand about the ART treatment, like what are the benefits of ART treatment. So while the person interact with the ICTC counselor after getting the result, so through the post counseling they can explain the benefit of the ART program and how it can be helped to make them healthy throughout the life, and they can ensure that client reach to ART center. So although that is the mandate as per the guideline, but again we can enforce for the referral to the ART center. So the second important key stakeholder in this all cascade is ART center. So the role of ART center is important for the treatment preparedness. So the counselor can provide the counseling for the treatment preparedness, because through this policy, through the treat all policy, we are trying to make all pre-ART people on ART, because we are putting all the pre-ART people on the treatment. So it should not realize to the community or person living with HIV that it is forced. It is not forced. It is the health right of their, and it has to be explained by the counselor during the counseling while they are initiating the treatment. So they should prepare them for this lifelong treatment. And when it comes to the other aspects, then they can also explain about the side effects of the treatment. They can also explain that this is the free treatment by the government of India, and the treatment is very simple now. It is fixed dose combination. It's only single pill in a day. So treatment is very simple now, and it is easy to take. And like it is given by the expert people in the special expert treatment settings. And counselor also can help to make the treatment goal for the individuals, like people living with HIV or person living with HIV, when comes to the ART center, whether he or she should know like what is his or her treatment goal. So for the setting of that treatment goal, counselor can help them that how they can make this treatment goal for their lifelong. And they can also make the referral for the care and support services. Whether the client needs the other services for the non-health needs, then they can refer to the care and support center. After ART center, the essential role of care and support centers in the treatment cascade. So when the client come to the care and support center, then our peer counselor can provide them the peer support as much as the client required. In initial phase, as we all know, when client came to know, or when a person came to know that he or she is having the HIV positive status, then it is very difficult to accept first that he or she is having the HIV virus. When they realize that okay, it's okay, I am having some infection, so it is very difficult to cope up with the fear, with the anxiety which they have about the HIV. Like if they tell someone like, okay, he or she is HIV positive, what will society think? Because HIV is directly related with the character. When some person talks about this HIV, then they thought, okay, this person maybe do something wrong. He did something wrong. That's why he get HIV or she get HIV. So that kind of myths they already have in their perception. So that kind of myths has to be removed by the peer counselor. They should make them understand like this is not only related with the character, or it is not related with the any kind of significant behavior. First of all, they have to explain like how HIV spreads, how doesn't spreads, how they can live with the society. So they should give them peer support very well. And then they can also involve to newly detected PLHIV in the support group. They can invite them on the priority basis in the support group meetings, which CSCs are conducting on the monthly basis. After that, they can also support them to make their own support system within their family, within their friend circle, within their neighborhood, within their surroundings. So first they have to understand them, like in which kind of situations they are living, in which kind of family settings they are living, which kind of family settings are which they are living, and how their family members are thinking about them. So that is very important, because there is the role of ART counselor and there is the role of peer counselor. It is very important. When the client come to us or PLHIV come to us, he or she should realize that I can explain all my problems to them. When we explain all his or her problem or challenges, then we came to know like how is their family member or behavior, how is their behavior, how they are treating them after knowing HIV status. So at that time they need very much support from our side. So like it is overall about the treatment adherence and retention, like how we can behave with the client in the initial phase, so it can be adhere 100% or they can retain in the whole HIV care cascade. So now we can see the objective of ART program. So what kind of objective our national program has? So ART program has the objective to maximal and durable suppression of replication of HIV. As we all know that first role of ART is the HIV prevention. So it reduces the HIV virus replication, and it is now like ART now the globally acknowledged that it is the preventive therapy. It is not any kind of emergency. So because ART help in the replication of HIV. It is also helps in restoration or preservation of immune function. It helps reduction of HIV related morbidity and mortality. And ART also minimize the drug related side effects. Involvement of quality of life, improvement of quality of life. So when the person will take this therapy, so it definitely improve the quality of life. So these are the objective of ART program. So now, as I mentioned, like our government of India already announced the policy, test and treat policy. So under this test and treat policy, what will be the approaches, what approaches ART can adapt and what approaches community led organization can adapt, and also the other key players or other key stakeholders can adapt. So we can talk about some new approaches which already government of India adopted and our service provider has adopted. NACO already sent the government letter to the all ART center and state AIDS control societies. So now we initiated all priority we initiated the process to put all priority person on the treatment. But before that we have to realize them that ART should initiate to all PLHIV who are eligible for the treatment. So in regardless of CD4 they can initiate the treatment. In regardless of clinical stage under the national ART program they can initiate the treatment. But how it will impact on the overall program? So we can say like all pre-ART people will come to the on ART in the next few months. So it may increase the burden of ART centers, and it may increase also the footfall of the care and support centers for the new client. And also among them there are many people or many PLHIV who has the asymptomatic, and there are many PLHIV who are not frequently visit at ART center, although they are pre-ART and they are supposed to come within the 6 months, but they are not coming at the ART center every 6 months. Whenever they have some problem, at the time they are coming. So sometimes it's also after initiating they may result that the few numbers of LFU can be increased at the ART center. So now we are moving on the next section of the presentation. It is treatment preparedness. So what is that treatment preparedness actually? So from my experience I can share that it is all preparation for the life, I can say. Without ART like we cannot assume the healthy life of PLHIV, because when the people initiate ART in later stage, they might have some critical problem, and for that they also lose their faith in the treatment. So now, as per this test and treat policy, when we are initiating ART for the pre-ART people who has the good CD4, who doesn't have any kind of symptomatic health problem, but we are initiating their ART also. So for this lifelong treatment, how we can prepare to that person, it is very important. So preparation for this lifelong treatment, it constrains the role of ART centers, that is very important, and it also constrains the role of CSC people, which is led by civil societies, NGOs and community-based organizations majorly. So when we talking about the role of ART centers, so it is very significant role. When the person come after ICTC to the ART center, or when the person come after having 3-4 years without any treatment. So first he or she should understand, like it is HIV is a manageable disease. It is not like it can't be managed in early stage, or it can't be managed in a life period. It is manageable disease. So that should be explained by the counselor of ART center. And though it is lifelong treatment, so the person should be adhere 100% for this treatment. That understanding should make by the counselor of ART center. And when we are saying that ART center counselors, so it includes all the gender specification also, like when we entertaining to the PLHIV at ART center, so there are different age groups, there are different genders which are coming, like male, female and transgender community. There are children which are having HIV, they are having very good CD4, but they doesn't are on treatment. So now they are initiating the treatment. So those conditions which they are facing earlier, like without ART they are living their life healthy, why should they start ART now? So those kind of perception they have. So in that situation, ART counselor should explain that it is very specialized care centers, like with the ART centers. They are having all the trained staff which are prescribing their medication. They have the medical expert as a medical officer or nodal ART center officers. They have the specialist counselors there. So they have to appraise their services first, and then they can explain about the treatment aspects. So the important thing is in India, this treatment is free. That is free of cost for all people living with HIV. So that is very we can say this is the advantage of all of us. So they have to explain that, and it's very simple treatment. It is a single pill in a day. They have to tell them. It is not very critical. It is not having lot of pills. So they can explain that it is very simple treatment. You can initiate. You can take the pill in a day. Then they can explain the benefit of treatment, like how treatment can make them healthy. So they can present some examples, although they are looking in the communities, like there are a lot of people who are taking the treatment since 14-15 years and they are leading healthy life without any stigma in society, without any discrimination in their family members. So they can also produce some example in front of them when they are initiating the treatment. And they can also assure the confidentiality. They should assure that confidentiality, that their information will not leak from this system, because our system, our ART system or our ART program system is very strong in terms of confidentiality. We are following the all guidelines recommended by the WHO, recommended by the NACO. So they have to make them comfort, like this is a very comfort place where they can share their all experience, and they can also make them feel free that all information should be kept here in very confidential manner. So they can explain all those things in front of client while they are initiating the treatment. They can also explain that this treatment will improve their immune system. They will free from other opportunistic infection while they are starting this treatment, because if they are not having ART treatment, maybe they can have frequently other co-infection or other opportunistic infection. So it will also reduce their financial burden if they start this treatment. So it will also reduce their financial burden. It will also improve their health. it will also improve their all stamina. So they can explain all the aspect of treatment. Then simultaneously, there is also a significant role of care and support center. So while the newly client are being initiated ART, so ART counselor also can refer to the CSC to that particular client, or they can also interact at the ART center, because our peer counselors mostly they are sitting at the ART center. So while the newly initiated client has come to peer counselor, then they have to interact with them, and they have to give the quality time during the interaction. So while they are talking with that new PLHIV who is initiating the treatment, so they can understand their life challenges, their experience, and their all kind of background. So while they are interacting with that client, they can also share some good example from the communities, like, okay, I am also taking the treatment since this much years, and I'm leading a healthy life. I'm taking care of my children. I'm also earning for my family. I'm also having all kind of social relationship. So they can also set their own examples, and they can explain their experience. So CSC can play a significant role to define a supporting system for the client. They can also mention like what kind of support already they have, like we have district discrimination response team, which can resolve all kind of discrimination cases in the local area while the client are facing in their own locality or in their family or in their neighborhood. So immediately they can respond through the DRT system. So peer counselor also can explain that about this community support system, like what kind of support system they have. Like they have the provision of support group meeting, they have the provision of discrimination response team. So this kind of services CSC have, so that all services should be explained by the peer counselor. And if the client have problem with the families, or if the client have some kind of challenges with the surroundings of family members or society members, then our outreach worker or peer counselor can make the home visits or family visits to them, so they can sensitize during their visit to their family members, their spouses, their partners, or their children. Sometimes children also doesn't know about the HIV, what is HIV exactly, and while the person disclose among the family members, then surprisingly they ask so many questions. So while our peer counselor or outreach worker, they are visiting to their family, they can explain all the aspects of HIV and treatment related. And also they should keep them, and they should make them assurance, like confidentiality also should keep by the peer counselor or by the all staff of care support center. So they can make them assured, they can gain their faith during the interaction, during their communication. And also they should give the various health and non-health services detail to them. So how, if they face some kind of side effect, or if they, the PLHIV will face some kind of health problem during the initiation of ART center, so they can explain all the all easy available services by the government, or all the health services, what can be the assess in their nearby area, so that can be also explained by the peer counselor. And peer counselor should also explain the tracking mechanism of the loss to follow-up cases. Like if somebody will drop out the treatment, so how CSC will track them. So they can also make them comfort by telling about this tracking system. So to achieve this goal, which we are telling consistently, like we have to retain PLHIV in the HIV care for long time, for a lifelong period. So for this goal, our key message is that like all priority members should keep on the ART treatment, but ART is not an emergency intervention. ART is a need for each person living with HIV. So they should start ART very immediate after knowing their HIV status. It is also benefit for that person who is initiating the ART in early stage, because he can avoid the many of co-infection, he can avoid the many of other, he or she can avoid the many of other opportunistic infection in their life period. So that can be explained by the both service providers, ART centers as well as care and support centers. So what key messages ART center can give during the initiation of the newly detected PLHIVs? They can help them to understand about the treatment process and procedure, like what process they should follow. So while any person initiating the treatment, so they can explain like you have to go for all baseline diagnostic. When you are getting back all the reports of all baseline diagnostic, then after that you can initiate your ART. And they can also make them comfort, like this is not like very difficult infection or disease, so it can be managed, like BP, hypertension or diabetes, it can be manageable. So like the BP sufferer, they are taking the medication for lifelong. Similarly, the diabetic patient also, they are taking the lifelong treatment. Similarly, you can take the lifelong treatment and you can keep your life healthy and better. And also they should explain that there might be some mild side effect of in a very frequent period of like during 3 months or 1 month or 1.5 months. So they can explain about all the side effects, like what can be the common side effects, and it can be effectively managed by the help of the doctor of ART center or any near health facility which is where the PLHIV are based or residing. Similarly, CSC can also enforce the same message, like this ART treatment is a lifelong treatment, life-saving treatment. They can save their life, they can expand their life period by taking this treatment. So they should teach the client about this treatment guidelines, like what are the guidelines for the treatment, how they can initiate, what are the procedure. So while the newly detected client are coming to the CSCs, so our counselor or peer counselor can explain all this treatment guideline, all the treatment side effects aspects, and all the OI management methods, like how they can manage if the person having little bit fever, cold, cough, or any other kind of infection, or maybe seasonal infection. So how they can manage by their own like some traditional methods or by referring by the near health facility. So they can teach about the all aspects of this treatment. So when the person initiate the ART, they may lot of apprehensions with them, because sometimes before the ART centers I also saw, like in my family, like my husband died after recent initiate the treatment because they initiate in the later stage. So that kind of examples might have in their perception, okay, if I start the treatment, maybe there is chances to death, because this treatment is very heavy. This treatment is takes like lot of care. It needs intensive care. So like that perception they have. So before initiating the treatment, all key service providers should address all apprehension of the client, all the fear, myths which they have. So they should make them feel comfort before they initiating the treatment. So from the ART center side, while they are interacting with the client during the counseling, so counselor can explain or they can just first listen to the client. They have to give them the time. So while the client telling them all the aspect of their perception, like what kind of perception they have about the treatment, the first counselor has to listen about them. After the listening, after that they can respond them, like okay, this, if you are initiating the treatment in early phase, so you can avoid all these circumstances which leads that AIDS situation also sometimes if they start in later phase. So while they are starting in the later phase, so it can be lead all the other critical infection, and it's really cause to the death sometime. So those explanation, those clarification need during that interaction, and they can also educate to them about the common myths. Like there are a lot of myths about this treatment initiation. Like sometimes people ask, okay, after this initiation of ART, maybe there is the chances to get off from the HIV virus, or HIV can be cured after this treatment. If I am taking 2-3 years, then my virus will gone. So this kind of myths also sometimes community people have. And sometimes they heard from some kind of media, social media messages. So they also have a lot of humor inside of them. So like sometimes these messages misguided them. These messages gives some kind of misunderstanding about the treatment. So our counselor's role is very important in that sense. Like they have to explain all the proper guidelines, all the treatment regimen which the person individual is starting or they will take. So they should explain all the aspect of that. And also they can reinforce this message that there is no cure, but the ART is the preventive strategy or preventive therapy to reduce the HIV replication in your body. So they can reinforce this message. And they should also educate to the client about the do's and don'ts along with the treatment. Like some clients, like if we have seen, we all are working in this field, and we have seen like a lot of clients which are doing the labor work, which are doing the daily wages work, which are doing the driving works. They are used to have the habits of daily alcohol, tobaccos, and other addiction they have. So while we are interacting with the clients, we can explain about the all aspects, like while they are initiating the treatment, they should avoid all these practices of alcohol, tobacco, and other drug habits if they have. So we can avoid, and we can also suggest the way, like how they can overcome. If some person are coming from the drug users background, so they can also suggest, like there are some OST centers in our state or in our district. You can go there, you can link with them. So we can also suggest some kind of suggestive way to overcome from this problem. If there are some PLHIV who are alcoholic and they are not in situation to leave that habit, so we can also suggest some de-addiction centers addresses, or we can also refer them for those centers so they can overcome. So like that, the counselor can explain all the do's and don'ts along with the treatment. And similarly, CSC should also explain all the messages about their fear and myths. So while the peer counselor interacting with the newly detected clients or with the newly ART initiated clients, they can explain about the common quacks. Like in some of the states, we also had the practices like some of Unani doctors are there, some of like locally practitioners are there, which are claiming that they can cure the HIV. So our staff role is very important in that sense. They can explain the exact importance of ART treatment while they are explaining about the already existing people which are taking the ART treatment since 10-15 years, and also they registered with the CSC already. So they can explain about them. They can just share their examples without taking the name. While they are sharing the other PLHIV examples, CSC should also keep the confidential guideline. So while they are telling them, they should not keep any name. Just they can share the example. Just this XY person is taking since 10 years, 15 years treatment, and they are leading the healthy life. They are taking care of their families. They are having their routine employments. So that kind of examples they can share. And while also when they are explaining all these aspects to the clients, they should also tell them about the side effects. Like if in initial phase of ART initiation, the person have some kind of side effect, so they can manageable. They can manage at their own. Like sometimes, like I have regular headache, so I can take some medicine at my home. I can keep some like regular medicine at my home. And while I am traveling, I can keep all those medicine along with me while I am traveling, while I am going outside of the town. So those kind of tips they can give to the PLHIV while they are interacting with them. If the person have like severe side effects, like if they have some kind of kidney problem, liver problem, then immediately they should refer to the medical officers or to the medical centers. We should not wait it can be cured at the home base level. So they should refer immediately. So that kind of situation also explained by the peer counselors. If the client have any emergency, they should immediately refer to the nearby healthcare center or to the medical officer of the ART center. And similarly, CSC should also explain about the do's and don'ts along with the treatment. As I already told, like there are few community people who are having the habits of alcohol, tobacco and other substances. So we can tell them, we can explain them the benefits of the treatment while they are avoiding the alcohol during the treatment. So it can be more effective for their life. They can lead more healthy life without any much critical side effects. So for to achieve our this preparedness goal, we have to take the commitment from the client also. Like it is not a whole soul role of ART center. It's not a whole soul role of care and support centers or other service providers. It's also the commitment for adherence from the client side. It is very important that person who is initiating the ART, he or she has to understand like why adherence is important. And first we have to explain like what is the adherence. So adherence means like the person who is taking the ARV, it is lifelong therapy and it should be taken on the time. Okay. So when we are telling them like this is the lifelong treatment, so similarly we have to make them commit to be adhere on this treatment. And what are the aspects which can be affect the adherence? What are the aspects which can be the affect their spread of HIV? They can also prevent their HIV virus in their body. So we have to tell them all the aspect of positive prevention. So while the ART counselor interacting with the client, or while the CSC people also visiting them, so they can explain about the adherence part. So the role of ART is very important in this. While the counselor are counseling, so first they have to explain about the importance of adherence, like why adherence is important. So they can explain like to avoid the resistance of medicine, the adherence is very important. If they not adhere on the treatment, there are the chances of treatment failure. There are the chances of the treatment will not work in their body. So there are the chances to shifting the treatment very immediately. So we have to explain them the importance of the adherence while we are talking about the treatment. So first of all, they should know like what is the adherence and how they can keep properly in their life period. So we have to educate them what kind of methods they can adopt for the adherence. Like they can just set some reminders, or like before the due date, ART also can call them, or in their family settings they can make some arrangements. They can make some person responsible to remind them. Sometimes like client is not in situation to have to remember, like if he or she has some infection or some kind of illness, and during that time they are not able to remember that the time of ART medicine. So that time their family member can remind them. They can also set some kind of alarms. They can also set some kind of timings, or certain things they can make to remember the due date of ART also. Like while they are having the date of ART visit, so they should keep remember that they should keep visit on that particular time. So all these aspects can be explained by the counselor, and they can also explain like what is the positive prevention. So most of the time person understand by the positive prevention is like HIV should not spread. Okay. But there are all other aspects which also constrains the positive prevention, which includes like family planning, which includes the other STI management. So there are a lot of aspects of positive prevention. First of all, the person should make commit that I will not spread HIV, that this virus will live within my body, and knowingly I will not spread this virus. So they should keep all the safe methods, and they should explain all the methods for positive prevention while they are counseling. They can also demonstrate some kind of methods which more popular, and we all know like condom is the best method to make positive prevent from the others, and that positive person also can be prevented by others. So the condom is the best prevention method in our health system. So they can demonstrate about the condom uses, and they can also explain about the importance of that consistent use of condoms. Sometimes people has the perception like we doesn't want family planning, or we doesn't want child, so why should we use this condom? Okay, so in that situation, counselor has to explain the importance of this prevention method. Then our AIT people have that corner for IC materials. So most of the time, although they are doing that, but they can also explain by the IC some pictorial things they can explain to maintain the positive prevention methods. And in the case of pregnant women, they should make sure that the pregnant women should link with the PPTCT program. So that is very essential part of the prevention. So we can make sure that every pregnant woman should link with the PPTCT program. So similarly, there is also a very important role of the care and support staff to making the committed for the treatment. The all client which they are entertaining during the peer counseling, all client which they are entertaining during their CSA visits for the newly client, so they can explain about the buddy groups. So care and support centers have the provision to make some support groups. So they can explain about their groups, like how many types of groups they have. Like they have some male-female groups, they have some transgender groups, they have some key populations groups like PWID groups, sex workers group. They have some gender-based group like some male-female, as well as in female also they have subgroups. Like some groups are for pregnant women, some groups are for single household women. So similarly, they also have children group, adolescent group, youth groups. So a lot of kind of support group they have. So they can explain about all these groups and what are the importance of this group. While the peer counselor or counselor is interacting the client, they can explain, like they can feel free to share their experiences in these buddy groups, because these are the peer groups where the newly detected client or newly treatment initiated client can share their experience with their lives, share their experience with their treatment aspects, so they can feel comfort within these support groups. Similarly, we have the provision of thematic counselor, master counselors at the care and support center. So while they are giving the counseling, so they have to emphasize on the treatment adherence part for the newly client, which because specifically when the newly detected client who initiated the treatment or the client who initiating newly treatment, so they have to understand about the adherence, and importance of adherence is very essential to keep the lifelong treatment. And again, they can also produce some examples, they can give some good examples in front of them while they are dealing with a lot of people who are stable clients at the ART centers, like who are taking the treatment since 10-15 years. So they can also take their examples and they can explain like how they are leading their lives. They can also they can also share some documentaries or some video clips or some audio informatory materials to explain them the importance of adherence, to explain then the positive prevention. There are a lot of documentaries which developed by the development agencies or NACO, which says like people who are taking the treatment since too many years, how happily they are living their lives, how carefully they are living their lives, how carefully they are making their families happy. So that kind of the case studies or documentaries can be shared by the care and support staff. And also the care and support staff should make refer for the eligible client, family members or their partners who are eligible for the HIV testing. So they should make sure their referrals within the frequent time while they are interacting the person. So they can ask about the family members, they can ask about the children, they can ask about their personal behaviors while they are counseled them. After knowing that personal behavior, they can make the referral for their partners, their friends who are willing to test HIV and who are most eligible as per their behaviors. So now in the line of preparedness and in the line of prevention, we are also talking about the other co-infections and other opportunistic infection. So how we can prevent to the OIs. So while the person living with HIV is coming to the ART centers, so most of the time our counselor are telling about the ART treatment, but sometimes we miss the opportunity to tell them like very precisely about the other opportunistic infection. So if we are making them understand like what are the other co-infections which can be happen with the HIV while after getting the HIV, what are the common other opportunistic infection the person can get after immediate getting HIV. So the counselor should explain about the some prophylaxis, like if the person have initiate the ART, so they should also take this prophylaxis of CPT, INH and for other infection prevention therapies. So they can also make them understand like why these prophylaxis is important. And they can also explain about the universal precaution system, like how they can use this universal precaution system while they are interacting with the clients and while the client are coming to the ART center. So if they are using some gloves or some mask, so they can explain about the protocol of the universal precautions. So during this interaction, to make them better understand, because all the PLHIV are not very much educated while they are coming to the ART center. They have the level of education, but not might be all are educated. They are from the different communities, they are from the different educational background, they are from the different like local communities, local caste, they are from the like different occupations. So sometimes this understanding depends on the basis of individual's perception. So ART counselor can also use the pictorial chart to explain all this aspect of the opportunistic infection. They can use some common IC materials which explain and this information clearly about the OIs. And they should explain about the frequent screening of the TB and pap smear test or other STIs. So while they are telling to the client about the opportunistic infection, so they should emphasize, if suppose they are entertaining with the women who is having age of 30 to 45 years, so they should explain about the screening of pap smear. They should also explain about the sexual transmitted infection which can be correlate with the HIV and which can be also spread to their partner if they are not using the proper prevention methods. So those all aspects should be explained by the ART counselors while they are interacting and while they are telling about the treatment. So this is all the important part of the treatment. So similarly here the important role of the CSC staff is also essential. So while they are the PLHIV are going to the CSC or CSC staff are interacting at the ART center, so they can tell about the support group meetings which are frequently happening at the care and support centers. So client can attend those meetings on the time or regular basis. So during those support group meeting, CSC staff should give that information about the co-infection or about the other opportunistic infection. So they can also invite some external resource person to describe this information in very technical manner or in very easy languages which can be explained to the community people. So they can also invite some medical officer from ART center, or sometime they can also invite the counselor of the ART center. Sometimes they can also invite the TB HIV counselors. Sometimes they can invite to the PPT-CT counselors. So this opportunity can be grabbed through this support group meeting platform, and they can explain all the aspects of co-infection and opportunistic infection. And also CSC staff can take the opportunity while they are visiting to the PLHIV's home. So they can also give the information to the caregivers of the PLHIV or care providers of the PLHIV. They can tell them about the home-based care of PLHIV. If the PLHIV having some co-infection during the initiation of treatment, or if the PLHIV having some other infection like STIs or other co-infection like pneumonia, TB, jaundice, so they can tell them about the clinical aspect which is taken care by the ART center officers, and they can explain about the home-based methods which can be the tips for the management of those OIs. So they can also make them understand, like to avoid these OIs, how the hygiene practices are important. They can make them understand. They can explain all the hygiene practices which are the common practice, like hand wash is the very common practice which everyone should make sure after having the food or before the food they should wash their hands. Like other hygiene practice also they can explain, like during the menstrual cycle, how they can make their hygiene. During the delivery, post-delivery hygiene, how they can maintain. So all these kind of aspects which could be explained by the counselor during the interaction or during the field visits of the client. So in this similar series, nutritional is a very important aspect. So while the PLHIV or person living with HIV initiating the treatment or having the treatment, so nutrition is very, very important along with the treatment. So while the person having the treatment, so treatment solely will not work. It needs proper and balanced nutrition. So we have to realize to the client while they are coming to the ART center, and while we are having the counseling sessions, while we are giving to the time, so we should not forget this important aspect. We should tell them about the nutrition aspect of the treatment. So during the counseling, first counselor should assess the need of the nutrition for the individual client, because if they came to know about their backgrounds, about their financial status, about their affordness, about their all local traditional way to having the nutrition, after that they can suggest some way to have balance and nutrition food in their daily routine diets. So first they have to assess their needs as per like BMI chart. They can make their assessment individually. So they can explain about the all nutrition needs, like what kind of nutrition can be the more essential along with the treatment, and also they can refer to the client for the good nutrition or nutritious or dietary practitioners if they need the support from them. So sometimes like clients also doesn't know like what kind of food they should keep along with the treatment. So they should explain about the all aspects of the nutrition. And CSC also can play their important role during the counseling while the client are coming to the CSC center. So counselor can explain about the nutritional aspect while they also have the display. They have the nutritional chart. They have some kind of flow chart for the dietary practices and nutrition chart they can explain. They can also demonstrate some kind of foodie practice and some kind of nutritious food they can make the home, how they can make that kind of nutrition food at home. Like for example, they can explain about the sprouts, like how we can make the sprouts at home, how we can make the food better nutritious while we are using the egg in some veggie food, or while we are having the milk, so we can also take some jaggery along with the milk. So those kind of tips they can give during the counseling to having the nutritious food along with the treatment. So that is very, very important aspect along with the treatment. During the support group meetings also they can invite some external person to explain the nutrition needs and assess the nutrition need, or that the expert person also can explain the tips of make the food nutritious at home. Okay, so now we all, as of now, we all talk about that aspect of treatment preparedness and LFU prevention. So now again we are coming on the LFU data management, like how we can use this information and how we can use, how we can manage that data to prevent the LFU. So what kind of mechanism we can adapt at the ART center, at the CSC center. So ART center, while they are interacting with the client which are already pre-ART, which registered under the pre-ART, but now they are initiating the treatment. So while interacting with them in the counseling sessions, so they can take their current address and permanent address and they can update their phone numbers, contact details and alternative address. They can also make sure that priority should be given to the missed cases which are coming, falling down in the M1 and M2 categories. As we all know, like our month 1 miss are taken care by the ART center, so they can frequent call to them and they can bring them back at the ART center. And they can also, they should also identify the probable LFU cases in advance on the basis of their clinical and behavior history during the counseling, because these are not very new client, these are already registered in the pre-ART services. So on that practices, on the basis of those practices, counselors can identify the probable LFUs and they can list out their frequent follow-up with them. So in future they may not be LFU. Similarly, the care and support staff also can ensure their role in to maintaining, update their records while they are visiting to their homes, while they are interacting with them in the field. So while they are interacting with them in the field, so they can take their update address, they can update to the ART center records also. They can update while they are having the coordination meeting with the ART centers. So this may help to avoid the LFU. So now we are talking about the non-health needs, which is also essential while we are interacting with the clients at the ART center in initial phase. They are coming up with the many of socio-economic needs, many of their individuals' needs. So while our counselor are interacting with them, they should explain about the support system, what kind of support system they have, and what kind of support system they can approach, they can adapt. So this is very important while we are counseling. So we can identify their need first, and as per their need, as per individual's need, we can refer them to the other health centers or non-health centers like other social welfare department or other line department. Similarly, CSC also have that kind of role and they are already doing that work. They are making the referral as per the client need and after the assessing their need during the counseling sessions. So after addressing their needs and referred them for the other health services or other non-health services, so how it can help to addressing other aspects also. So there are other aspects also which are sometimes hurdling in the treatment. So there are some system-based issues which are facing by the ART centers. There are some systematical barriers which creates the misunderstanding for the clients. Okay, so sometimes like when the client come at the ART center, so it can be a perception by the client who are newly initiating the ART. They are thinking like may treatment will available or not available at the ART center. So ART center should ensure that timely intent to interrupt uninterrupted supply of the supply chain management. They should also prioritize the clients for the treatment based on the need. Like they should also make sure the conducive environment at the ART centers. Suppose sometimes the client are coming to the ART center from the key communities. So some people are pointing out, some people are making the gossips from the staff also. So it should not be the atmosphere at the ART centers. So we should make sure that conducive environment at the ART centers. And also ART staff should make sure that all system related feedback timely taken by the community people also, like through letterbox is a complaint box is having all ART center, so they can also make sure that all grievance system in place. So while the PLHIV are making some complaint, it should be timely identified and timely resolved by the ART center. So that kind of assurance which can be given by the ART center staff as well as CSC staff also, which are regularly going to the ART center and regularly sitting at the ART center, mainly the peer counselors. Similarly, the CSC can also advocate for their complaints which clients are having and which sometimes are being not addressed by the ART centers. So care and support staff can be also advocate for those complaints by the proper communication channel. Through DAPQ, through SEX, through ART coordination meetings, they can address those kind of problem and they can notify to the nodal officer and as well as DAPQ officer also. Now we are talking about the prevention of LFU. So how we can prevent the LFU and who could be the potential LFU. So first we have to realize that who could be the potential LFU. So ART should be the list out that which clients can be the potential LFU. So client who are becoming miss regularly and they are not following proper adherence, their adherence are less than 70%, that can be the potential LFU. Pregnant women who are initiating the, who is supposed to initiate the ART in their 4th month of pregnancy, but they are not coming at the ART centers. Migrant and truckers, people who are having the, who are having high pill burden, which are taken by the other health providers, like already they are taking some medicines due to other health problems. So due to that burden, they are not taking the ART also. So they are like some diabetes person, some person who are taking the depression medicine, some person who are taking the hypertension medicines. So those person can be avoid to take in this extra pill burden. So those can be the potential LFU for us. Clients who are asymptomatic but not coming regularly at the ART center and not doing their regular health checkup at ART centers. So those clients can be our potential LFU. And some clients from the key population also, they might have that kind of apprehension that behavior of counselor may not be good for me if I went back to the ART center. Maybe that counselor can be scold to me, and the doctor will also scold to me because I left the treatment in between. So sometimes they might have that kind of apprehension while they are taking back to the ART center and they are supposed to having treatment. So in initial phase of treatment, like in initial 3 months are very essential for to make them understand, like this is the critical period. This 3 months are very critical because all data shows that in initial 3 months more dropouts happens from the treatment, because these 3 months may some clients have some side effects. In 3 months may they have some kind of other infection. In 3 months they are feeling that okay, after 3-4 months I am feeling better, I don't have any other health problem, so I should drop this treatment right now. So like that people have some kind of their individual perception and some kind of their individual problems, and they are leaving the treatment in initial 3 months. So as ART, as ART staff and as care and support staff, we should make sure, like in initial 3 months, clients should have follow on monthly basis, and we can also interact during the field visits while we are doing the field visits for the other LFU clients or other regular registered clients. So we can make sure the visit of those newly detected and newly initiated treatment client, we should interact with them so that they can feel more comfort and they can feel more prepared for the treatment adherence. And in every interaction we can make sure that the all information about the preparedness should be given to the client. We should make sure that all we are available for the client when they need it. Okay, so care and support staff, especially for it is for peer counselor, they can also interact with the client on a monthly basis or weekly basis. On they can make the phone call. They can take their they can make some kind of relationship during the phone calls. They can just take their status, like how they are keeping with the treatment, how they are taking the treatment, are they taking the regularly or not, are they having some kind of problem in their family while they are taking the treatment, or while they are having some side effects. So they can take their status on the over the phone, or monthly basis they can also visit them. So these 3 months are very essential for the newly client, and it can be the chance to have the miss. So we can ensure like all the miss category should be taken up by the ART center, all the miss clients should be taken up, bring back by the CSC staff. So counselors can make some checklist to avoid this LFU. So they can prepare some exact checklist for those LFU which are like probable LFU for us. They can first they have to understand their expectation from the treatment and how the coping abilities the individual have. So they have to understand about their individual coping abilities. They can make their support system enable, and they have to realize about their socio-economic conditions. They have to understand about their current OI problems, other side effect problems. They have to assess their clinical or medical stages or their situations. Either the PLHIV has any kind of allergy from any kind of medicine. So they have to understand all the aspects of their clinical or non-clinical status. After that assessment, they can make a plan for the individual PLHIV, because every counselor has the certain clients in the certain period. Suppose one ART center have the daily load minimum 50 to higher 450, 500 clients. So they are entertaining as per their client load. And similarly, they also have their staff. Like some ART centers which are having 2 or 3 counselors. So the all counselors may not possible to maintain the all kind of records in one go. Okay. So for newly initiated clients, they can make some special chart or a special kind of checklist as per their assessment for individual clients. And they can support while they are counseling, while they are interacting with them in the next meeting, or while they are calling them over the phone. And to avoid that, they may be the LFU in the future, so they can make them call frequently, like before the due date, after just recent before the due date, and also CSC also can visit to them at their family members, and also they can make them comfort about their disclosure, because this is very important that client has to make disclose about among their family members. At least one person should know about his or her HIV status, because in the situation of illness, the person can help. In situation of treatment adherence maintaining, the person can help to that particular PLHIV. So it is very important to disclose someone in family, in someone in close group of friends. So this is again the same checklist we can make at CSC level or at ART center. So the record of individual client is very essential as per their need assessment. So as per their need assessment, they can also provide the further counseling session. They can also provide the support in out of ART center, or they can also make them refer to the other service centers. So now we are talking about the tracking of LFU, like how we can ensure the tracking of LFU. So why LFU is happen? The person when we became LFU, why it happens? There are 4 reasons majorly. So for self perception, their social condition, economic condition, lack of knowledge about the treatment, or their system related issues. So while client is coming, I already explained, like there are certain aspects like self perception. The client have the assumption if I go to the ART center after a certain period, maybe the client doesn't come since 1 year, 2 year, 3 year, or he is listening about the drug stockouts. So he may have he or she may have perception like, okay, I am going to the ART center, medicine will provide by the center or not. If I am taking this medicine again, it will work or not. Okay, it may be given me side effects earlier, maybe the side effect can be more critical this time. So this kind of perception they have. So how the ART center can address, how the CSC can address, I already explained, and these are the methods which I mentioned in the presentation. So we can reinforce all these methods, like how they can avoid the side effects, how they can make the home-based care at their own family level and their own surroundings. System related issues, they also might have the assumption like there are not the much space for the waiting, there are not safe drinking water, there are not clean toilets. So sometimes these problems also hurdles to client turn back on the treatment. So these kind of challenges could be addressed at the ART center level or could be addressed at the nodal ART center officers level. They can make them comfort, they can make all these kind of feasible efforts to make these basic facilities at the ART center. So to avoid the LFU, how we can ensure like our system is like more essential to avoid the LFU. So we can make our system very prompt, we can make our system very strong in terms of making the data, in terms of data sharing, in terms of making the regular update at the ART center. So there are some tips while we are having the ART CSC coordinations, we can follow these tips. So after having this kind of habit in regular ART CSC coordination meeting, I know many of ART center, like majority of ART center and CSC are maintaining the ART CSC coordination meeting records. But while it comes on the data validation and it comes on the record keeping and updation, that might be there are some lacking. So we can ensure while we are sharing the data, we can update some addresses while CSC is updating in our meetings. We can ensure that all detail of co-infected clients, like whether the clients having the co-infection right now, so they can update all the information in their records. All PNC, ANC records, they can update it in their white card. So this kind of information sharing and keeping validate and update the information, it helps to strengthen the system to avoid the LFU in future. So just I'm sharing one example here from the field, which we are whether we are having a lot of good example from the field, like how the teamwork, our teamwork help in the tracking of LFU. So there are certain role of the ART center, there are certain role of the care and support centers, but if we are together, if we are working hand to hand, join hands, so it can avoid the LFU and it can ensure that 100% tracking of LFU. So there was the migrated couple in the Gujarat, they worked on the contractual basis in Ahmedabad. So they tested in the ICTC. And they found 0 positive in Chandrakheda ICTC center. After knowing their HIV status, they are supposed to initiate the ART, but they don't initiate the ART, and without information they moved at the Jharkhand. So when we came to know through ICTC counselor that they moved to the Jharkhand, then our Jharkhand CSC team helped them to track them there in a remote village. And after getting their address, they went there, they talked with that couple and they initiated their ART in Jharkhand, Daltonganj ART center. That time the lady was pregnant, and during the delivery the lady went to her maternity home, and then there she delivered the baby at home. While the CSC team came to know like that lady delivered the baby, so to giving the Neuropin syrup, that the CSC people struggle, and with the help of ICTC counselor, they took the Neuropin syrup and they went at their home, which was the like 40 kilometers away from that ICTC, and they give that syrup to the baby. And they counsel to mother for that further testing of that infant. Then, however, they come at ICTC and they are able to make the DBS test for the baby. So that results comes for the DBS test is non-reactive at first test, but now again they went back to the other state. So now it is again challenge for the CSC and that particular ART center to revise DBS testing for that baby. So this kind of practices we are having in the field, like whether we are helping to each other, whether we are helping to the client to make them understand, to build their faith on us, then they are able to come again in our system or in our treatment cascade. So it is very important to work with better mutual understanding and better coordination. So here I am presenting two prompt strategies to ensuring 100% adherence to avoid the LFU. So if we want prevention of LFU, so we should ensure uninterrupted supply of drugs or medicines at ART centers. We should ensure the client-friendly environment at the service delivery. We should ensure the peer support for each client which is needed. We should ensure the treatment literacy for the client while we counsel to the ART center. And the second strategy is for existing LFU, how we can make the better tracking system. So we should focus on the MIS case tracking system. We should focus on the data quality and timely data sharing. While we are having the monthly coordination meeting or other coordination meeting, we should make sure that data should captured properly by the ART center as well as by the CSC people. CSC, PCs and other responsible staff should notify to the ART center periodically. Effective outreach, no doubt it is very important part for the care and support centers. If they are making the effective outreach for the each LFU, they will able to track them back to the ART center. There are very less percentage which we are not able to track them back. And fast tracking clients. If we came to know like this is the monthly LFU list coming at the CSC center within the first 2 weeks of the month, then CSC are able to track them the current LFU. So thank you. If you have any kind of question, you can put on the screen and I will respond. If I am not able to respond within this time, then I will mail you my answer. So ITECH team will facilitate to answer all of those questions. Thank you so much.
Thank you, ma'am, for this informative session. Thanks to all the participants for patient listening. All the participants are requested to kindly enter the e-poll which is going to display on the screenshot.